Name, Denise Smith. I'm 28. Occupation, general manager, restaurant, server, you name it. I do it at the restaurant. And I'm here for lower back pain, generally. That's the main cause right now. I wouldn't say often. I think it's just more of like when I tweak something once in a while. Yeah. Like if I do a pose that I can do that in yoga, and then I'm like, no, I shouldn't have done that. It'll be like an instant, like you need to stop. Usually if I'm pinching it, if it's my lower back, usually I'll just feel like kind of like a shock, like a stab pain. And then I'll just immediately stop. Yeah. And then I'll just like kind of try to like be like stretch. Now, I know I can still walk. So if I know like I have an issue with walking, that's like my okay, there's a serious problem. That would be like an 8-9 for me. This is okay. But as soon as I like want to go back, it's like no good. Like this is like all day at work, I was like sumo squatting, just being like, I can do that. But as soon as I like move backwards, it's yeah. Or if I do like any full, like that's when it starts straining.
So Madison was
I can walk normally-ish now. Yeah, so much better.
You know the build. Well, it's just a touch better, isn't it?
Yeah. I couldn't do that this morning. I was literally like bending over to pick up a fork. I was like, I'm just gonna leave it. We're just gonna kick it. Yeah. Yes, because I couldn't do this morning. Yeah. Oh, that's so weird. That was fast. That's it. Usually I would just deal with that for like 4 days and be like, it's fine.
Let's see that.
I couldn't do like this morning. No. So like definitely like it's a little tight still here, but like nowhere near what it was this morning. Because I was like decrepit getting out of bed. Yeah, just a little stiff. Okay. But not bad.
Okay, let's sit down.
Yeah, I definitely feel better this morning. I couldn't bend backwards. Like picking up a fork at work was hard, where now I can like squat if I needed to. I was fine that way. And then bending backwards, I'm like, it's fine. It's like the slightest tender, but like not like that sharp.
7 out of 10.
Yes.
No pain now.
No, yeah, no.
Good.
It's not like painful. It's just there. Yeah, just stiff, but that's fine.
So you're happy with the treatment?
Yeah, I can't complain.
Would you recommend it?
Yeah, definitely.
So, yes, really good.